In 1950, a new wing of the Vulcan General Hospital was opened. Staffing was a huge problem. In fact, the very existence of the hospital was threatened by a shortage of nurses. There were times when this 25-bed hospital was being staffed by 3 nurses who were providing round-the-clock care. It was not unusual for there to be 6 or 7 maternity patients at any given time, who in those days stayed 9 or 10 days. The people of Vulcan realized that if the hospital was to remain open, more nurses needed to be hired. The board was having trouble finding Canadian nurses, so they advertised in the UK offering to pay their passages, better wages, shorter working hours, 365 days of sunshine, mountains, and a white Christmas. The ads were answered, and soon young women from Northern Ireland, England, Scotland, and Wales sailed to Canada to help in our small rural hospital. Mary Lawson Heslop from England, Isabel Bowden Popovich Graham, Peggy Anderson Todd, and Kay Spence Lugace from Ireland, Marg Kerr Tyler, and Winnie Proctor Marshall from Scotland. There were others, but these are the ones who made Vulcan their home. These women were all midwives and helped to deliver many of the babies well into the 80s. They were well trained and had worked in large hospitals and brought new ideas. Not only did they help to establish a standard of healthcare excellence, they also enriched our community. They married local boys, raised their families here, and became actively involved in the community. Many of their children and grandchildren are still living and working here now. The recruitment of these nurses is just one of the many examples that shows that we can overcome many challenges when the community works together. Please join with the Vulcan County Health and Wellness Foundation's efforts in furthering our current capital project.